Your blood type already knows what can kill you, and most people have no idea. Every letter on your medical chart represents a survival system your ancestors used to fight infection, recover from injury, and survive childbirth. But those same evolutionary advantages also come with weaknesses. Weaknesses that show up today as certain infections hitting harder, certain diseases appearing more often, or even complications during trauma or pregnancy. We're breaking down the hidden biological dangers behind every major blood type, OA, B, and AB, in both their positive and negative forms. Some are more vulnerable to severe dehydration, some bleed longer, some are more likely to clot dangerously fast, and one blood type faces a pregnancy risk so serious, it changed the history of medicine by the end. You'll know exactly what risks your blood type carries and what it protects you from. O positivity is the most common blood type in the world, but being common does not mean being protected. The first danger comes from the H, antigen, a surface molecule that O-type red blood cells expose more than any other blood type. This exposed structure acts like a landing pad for certain pathogens. Two of the worst offenders are cholera bacteria and the norovirus, both of which bind more easily to the H antigen. That means people with O-positive blood are more likely to experience severe dehydration during gut infections, more prone to intense vomiting or diuretic propyliantion, represented in severe cholera outbreak studies, show that O-types often have more symptomatic reactions to common stomach. The second danger is hidden in your clotting system. O-type individuals naturally have lower levels of von Willebrand factor and factor VIII, two proteins crucial for forming clots. This means O-positive people typically bleed longer. After injury or surgery, this trait protected ancient ancestors from stroke and excessive clotting. But in modern trauma scenarios, it can become a real vulnerability. A car accident, a deep cut, a surgical complication. All can become more dangerous when your blood is slower to clot. A positive blood looks safe on paper, but carries one of the most underestimated risks, the A antigen on the surface of a type. Blood increases the body's tendency to form clots. This is called hypercoagulability, meaning your blood clots faster and more aggressively than usual. In some cases, this becomes a clinical advantage. Faster closure of minor wounds, stronger response to bacterial threats. But the hidden downside is serious. A plus individuals have higher rates of deep vein thrombosis, pulmonary embolus, coronary artery disease, heart attack, and stroke. They also have higher levels of fibrinogen and factor VIII, both associated with dangerous clot formation. The A antigen also interacts with the immune system in a unique way. It can trigger stronger inflammatory responses, which researchers have linked to higher rates of rheumatoid arthritis type 1, diabetes, autoimmune flare-ups. Another hidden vulnerability is cancer risk. Several epidemiological studies show type A blood is linked to higher rates of gastric cancer and pancreatic cancer. One reason? The A antigen changes how cells stick to each other and how they signal immune activity, potentially influencing how tumors grow and spread. Even infections can hit. Helicobacter pylori, the bacterium behind stomach ulcers, interacts strongly with a tight tissue, causing more severe inflammation than in other blood types. B-positive blood makes up about 10% of humanity, and it has its own hidden liabilities. The B antigen interacts differently with the immune system than the A antigen does. People with B-positive blood tend to show higher levels of inflammatory markers, including C-reactive protein factor X. These markers are associated with vascular inflammation, especially in the legs and extremities. Over time, this can raise the risk of peripheral artery disease or circulation problems, long-term cardiovascular strain, the digestive system. The B antigen creates another vulnerability. Some gut pathogens, including certain strains of E. coli and Salmonella, attach more easily to B-type intestinal tissue. This can lead to more persistent digestive infections and more intense symptoms during outbreaks. B positive isn't the most dangerous blood type, but its risks tend to be chronic, slowly affecting circulation and inflammation over many years. A B positive E positive is rare, under 4% of the world, and its rarity comes with a unique biological profile. AB individuals express both A and B antigens. creating a dual signal that influences how blood vessels regulate inflammation and clotting. This can subtly affect endothelial function, the system that controls how blood vessels expand, contract, and respond to injury. Because of this, AB-positive individuals may face higher risks of microvascular circulation problems for this blood. Flow to the brain and extremities-related memory decline studies show AB blood types are overrepresented in certain populations with cognitive impairment, possibly due to chronic low-grade inflammation affecting blood flow in the brain. Their dual antigen system also may lead to less efficient immune responses against some respiratory infections. AB individuals enjoy the benefit of being universal recipients in transfusion settings, but biologically, their immune signaling is one of the most complex among all blood types. O negative is one of the most important blood types in emergency medicine. It's the universal donor, meaning almost anyone can receive O blood, but that same simplicity, lacking A, B, and Rh antigens, comes with major vulnerabilities. Just like O positive, O negative blood exposes the H antigen, making its carriers especially susceptible to severe dehydration during infection-induced reactions to gut virus aggressive cholera outcomes. But O negative has an additional risk, the Rh factor. Because O negative individuals lack the Rh antigen, pregnancy can become dangerous. If an O negative mother carries an Rh positive fetus, her immune system can attack the baby's red blood cells, leading to a condition called hemolytic disease of the newborn. Modern medicine can prevent it, but historically, it caused significant infant mortality. Another challenge, O negative individuals can only receive O negative blood, making emergency transfusion logistics more complicated. A negative via negative blood combines the risks of a positive with the challenges of Rh incompatibility. Like A+, A negative individuals are prone to higher clotting tendency, increased risk of thrombosylated factor VIII levels cardiovascular complications, but lacking the Rh antigen adds another level of vulnerability, especially during pregnancy. If an O negative mother carries an Rh positive baby, the immune system may attack fetal blood cells. Just as with O negative. Another issue, A negative blood is rare, under 2% globally. In trauma or surgery, finding compatible A negative or O negative blood can be difficult, increasing risk when time is critical. B negative Ib negative is one of the rarest major blood types, around 1% of the world population. Its risks include elevated inflammatory marker, chronic vascular stress, higher long-term cardiovascular. RISK-B negative individuals also face increased vulnerability to intestinal infections because certain pathogens attach efficiently to the B antigen in the gut. But biggest danger is scarcity. B negative people can only receive blood from B negative, O negative in emergencies. This tiny donor pool becomes a real threat. AB negative of negative is the rarest of all major blood types, less than 0.5% of the global population. The combination of A plus B antigens and the absence of the Rh factor creates a unique immune challenge. Some studies suggest AB negative individuals may show less coordinated immune responses, meaning slower activation against certain viruses or bacteria. This doesn't mean immune deficiency, but rather an immune system that behaves unpredictably under stress. Scarcity is also a huge problem. AB negative individuals can only receive AB negative, A negative, B negative, O negative, all extremely rare. During major surgery, childbirth, or trauma, delays in finding compatible blood can raise complications. Every blood type comes with its own strengths and its own hidden dangers. Some types clot too slowly, some clot too fast, some attract certain infections, some complicate pregnancy, but knowledge is power. Knowing your blood type isn't trivia, it's a survival trait.